All right, good evening. It is Sunday night service, and I am Dani Williamson, and clearly Dr. Motley is not here tonight. So we are talking thyroids. So Dr. Motley will be back in 2 weeks. He's had some things to do. We are talking thyroids tonight, and also the state of the union on WP Thyroid and Nature Throid. So I just got back about 2 hours ago from Scottsdale, Arizona, where I met with the owners of WP Thyroid. They own RLC Labs, and we're going to discuss that tonight. But as you log on, hello, Lisa. Hey, Lynn. Hey, Ann. As you guys log on tonight, hit your heart button, hit your like buttons. We're going to get right to business. I'm going to talk about thyroids. I'm going to talk about Hashimoto's. I'm going to talk about hypothyroidism, tiny bit about Graves' disease, and then we're going to talk about what's going on with WP Thyroid and Nature Throid, okay? All right, so if you have a thyroid problem, I'm assuming most of you watching tonight have got thyroid problems. Hi, Mandy, or you wouldn't be watching. But the thyroid, which is located right here in the front of your throat, okay? Right here in the very front. It's the gas pedal of your body. Hands down, it is the full-blown gas pedal. It is the one organ, the one gland that controls your metabolism, right? It speeds up your metabolism. It slows down your metabolism. It controls 100% your metabolism. Every cell in your body has a thyroid receptor on it. Every cell, right? Your eyeballs, your brain, your ovaries, your uterus, your bones, they all have a thyroid receptor on them. And when this tiny little gland right here, that again controls your metabolism, when it is out of balance, it can wreak absolutely havoc on your body, right? As many of you know, right? Many of you who are not my patients, you go to providers who just check a TSH, a thyroid stimulating hormone, and that's not enough. If your provider is just checking a TSH, actually a TSH misses up to 80% of all hypothyroid patients. So if you have a provider who will not check more than TSH and tells you that's all you need to know, then you need to find a new provider. Am I right, people? You need to find a new provider if they're not checking more than a TSH. And we're going to go through this in detail. It is estimated that 60 million people, 1 in 5 people, have some sort of thyroid disorder, right? And most of those are undiagnosed. All right. Women are diagnosed with Hashimotos Thyroiditis 8 to 10 times more than men are. Women are diagnosed with autoimmune disease 8 to 10 times more than men are. Can you guess why? One of the reasons is we're the most toxic, right? We're the ones who put on the toxic lotion and makeup and hair color and lipstick and nail polish remover, shampoo, conditioner, deodorant, all those things, perfume, cleaning supplies. Here's the nose, here's the thyroid, right? You breathe it in, right to the thyroid, inflames the thyroid, out through the lymph system. So we are the most toxic. Do not ever put anything near your thyroid. And I'll repeat this again. Never put anything near your thyroid. No lotion, no makeup, no nothing near your thyroid. What you put on your body, you put in your body within 26 seconds flat. So don't put anything near here, right? So also when you have x-rays, when you go to the dentist, you make sure they put a thyroid guard right here on you to protect the thyroid, okay? So it's extremely important. Hey, Brooklyn, how are you? Yes, Mandy, we're going to talk about that. Lemongrass and frankincense. There's frankincense right here. Woo, yes, we are going to talk about that. But as a rule, don't put anything on your thyroid ever. So we're talking about just checking a TSH is not good enough. The research shows that providers, physicians, they were talking about physicians, but I know it's nurse practitioners and PAs as well, are practicing about 10 to 20 years behind what the literature shows on true research. And that would be research on anything. But of course, tonight we're talking about thyroids and Hashimoto's, right? So how do you make thyroid stimulating hormone? What is it about this thyroid right here? How does it work? Your hypothalamus produces thyroid releasing hormone, that's TRH. The thyroid releasing hormone goes to the pituitary. The pituitary makes thyroid stimulating hormone, okay? TSH. And then TSH travels to the thyroid, and that's where you make T4, which hopefully will convert beautifully to T3 in your body. T3 is what gives you your energy, your get up and go. T4 doesn't really do much for your energy. It has to convert. You have to have a lot of cofactors in there like selenium and things like that to convert over to T3 to give you lots of energy, okay? So what kind of thyroid disorders do we have? Hypothyroid, Hashimoto's thyroiditis, which is the #1 undiagnosed autoimmune disease in the United States. #1, Hashimoto's. It precedes hypothyroidism many times by decades. Decades people have Hashimoto's before they ever know that they have, they have Hashimoto's, but they never know it because they're just diagnosed with hypothyroidism because their provider's not checking a thyroglobulin antibody or a thyroid peroxidase antibody. Then we have hypothyroid, Hashimoto's, and then we have hyperthyroid. And then we break down into Graves' disease, hyperthyroid, too much thyroid hormone going. So what are the signs and symptoms? We're going to break down hypo and hyper. What are the signs and symptoms of hypothyroidism? Of course, dry, coarse hair, hair falling out, dry skin, the outer third of your eyebrows right here falling out, okay? That's a sign. Infertility, high cholesterol, fatigue, forgetfulness, weight gain, constipation, brittle nails, right? Slow heartbeat, just sluggish, hypo meaning slower, right? An enlarged thyroid, so a goiter. And we're getting ready to talk about or show how to check your thyroid. Muscle aches, real heavy periods or missing periods. It could be the same, or real heavy periods, like really heavy periods, okay? Depression, cold intolerance. You're cold all the time. Your temperature, less than 98.6 consistently. These are all symptoms of hypothyroidism. Well, how many people have a lot of those? Lots of us have those symptoms right there. What are the symptoms of hyperthyroidism? The total opposite, too much thyroid, okay? Hair loss, bulging eyes, those big bug eyes like that. Barbara Bush and George Bush, actually, both of them, George Sr., they both were treated for hyperthyroidism. Barbara had Graves' disease. That's those big eyes that pop out. Enlarged thyroid, you can have a goiter with hypo or hyper, sweating, rapid heartbeat, weight loss, diarrhea, very scant periods, like just teeny tiny little bit of period bleed for a day here or so, nervousness, muscle weakness, infertility, the same as with hypothyroidism, heat intolerance, difficulty sleeping, just tremors, like a slight tremor, just think hyper. Everything's ramped up, a little bit of anxiety. Those are symptoms of hyperthyroidism. And again, lots of people have all of those symptoms, not all of them, but they cross over quite a bit. So we have hyper, we have hypo, we have Hashimoto's, we have Graves' disease. And then we have thyroid nodules, right? So if any of you remember, this year I went for a bone density scan and I went for a thyroid ultrasound with Dr. Pascal Dauphin, who is my all-time favorite endocrinologist here in Nashville. And dang, I had a thyroid nodule. I have 2 nodules. I have one pretty good size one over here that's almost a centimeter, almost 10 millimeters, and one that was a little bit smaller. So the thing about nodules is it's the most common endocrine disorder out there in the United States. About 50% or more of people in the United States have a thyroid nodule and they don't even know it. And Dr. Dauphin told me that when I had mine done. All right. And generally it's diagnosed with an ultrasound. Okay. So there's all different kinds of thyroid nodules. I have patients who've had their thyroid removed because of thyroid nodules when people thought they might be cancer and then they turned out and they weren't cancer. I've had people who've had their thyroid removed when they couldn't tell them if it was cancer or not. And sure enough, it was cancer. So, there's lots of different nodules. There's a multinodular goiter, multi, meaning multiple nodules right here, okay? So you've got a lot of, or we don't have to have a lot, you can just have two. That's a multinodular. Those are abnormal enlargements, right, of the thyroid from a couple different reasons why people would get nodules: environmental and genetic factors, including iodine deficiency. Iodine deficiency is a really, really big trigger for thyroid disease, especially thyroid nodules, right? As a result, many times of a nodule goiter, your TSH is going to rise, right? And the thyroid gland, which is requiring more iodine, right, to function, continues to grow, and that's going to increase your nodules. So that's a multinodular goiter. And then we have cyst, thyroid cyst, and those are fluid filled, which, I mean, that's pretty common sense. Fluid filled cavities, right? They're actually benign most of the time, meaning non-cancerous. They're just thyroid cysts. Some cases they can be malignant. Most of the time they are simply benign. And we break that down into colloidal cyst, simple cyst, and then adenomas. So a colloidal cyst is caused by an overgrowth of just normal thyroid tissue, right? It's just extra thyroid tissue, and it causes a colloidal cyst. Then you have simple cyst. Simple cysts are hemorrhagic, right? And so hemorrhagic means blood. Blood is released from, or generally it's a ruptured blood vessel, right? And it builds up into a cyst. So you have that little buildup of blood and you've got some cysts there. So those are simple cysts, and the colloidal cyst. And then we have adenomas, right? And those are abnormal thyroid hormone producing tissues. So you've got multinodular goiters, cyst, and then we have inflammatory nodules. And that's what most people with Hashimoto's have. When they have nodules, they have inflammatory nodules. They occur with Hashimoto's. And basically what they're just telling our body is that we are producing antibodies to the thyroid gland. Lots of people, their provider will feel their thyroid, or they'll look at their thyroid and they're like, goodness, you've got a goiter or a nodule or something there. And lots of people are diagnosed, actually. I think it's something like 30% of people diagnosed with Hashimoto's actually are diagnosed from a thyroid ultrasound. Because the thyroid, and dang it, I forgot to bring my thyroid here. Darn, I have a great thyroid module. I just got off the airplane from Scottsville and ran to the office and got some things. Forgot the thyroid. But a normal thyroid is just lean, clean looking, and just beautiful little butterfly shape. A Hashimoto's thyroid is big, and it looks like it's been eaten by moths, or Swiss cheese looking, kind of holy and big, and just big looking. All right. So how do you check your thyroid? So I look at people's thyroids all day, every day. I look at people's thyroids in the grocery store. I look at people's thyroids in the restaurant, just out in public. And I'm like, man, I wonder if they know they got a big goiter going on there or something. So if you're going to check your thyroid, I went and found a mirror, which mine is all broken. Look at that. Like bad luck there. You get a mirror. You look in the mirror. So you're going to be looking straight on in the mirror, just like this. Thyroid is right here. As a rule, you're going to take a drink of water. I've got red wine here because it's Sunday night service, and cheers. You take a drink. You swallow, you put your hand here, and you see when it goes up and down, you can feel. Now, as a rule, you'll be using two hands, just like this. Swallow, and you can feel. I can't feel my thyroid nodule. Mine is over here on the left, and it's very flat to the skin, or to the thyroid. It's very flat. He told me I would never have been able to feel it. He couldn't feel it, in fact. But many times you can feel it. If you all follow me on Instagram, you'll know, you remember probably about 6 weeks ago, I posted a picture of a patient who came in. She had a 2-centimeter nodule right here, huge. She knew she had it. I didn't know. I was looking at her and I was like, holy cow, look at that nodule. So feel it, check your thyroid. And then if you feel something there, you know, you need to go have a thyroid ultrasound. So what are we going to do? What are the symptoms of a thyroid nodule? How would you know? If in fact you would know, right? Trouble swallowing, a hoarse voice, right? You just are hoarse, right? And that can also be a sign of thyroid cancer. So you have to, pay attention to that. Pain in the neck, the jaw, the ear. Those are all symptoms that could be symptoms of a thyroid nodule. Thyroid ultrasound is usually ordered by your provider. That's generally how it's done. And then it'll come back, and they'll come back, and the radiologist will say, it's either a multinodular goiter, it's a colloidal cyst, it's a simple cyst, it's an adenoma, what have you. They have their own language. And if it's over 10 millimeters, they will recommend a thyroid biopsy, a fine needle aspiration, it's called. And they take a needle, they numb it up, they take a needle, and then they aspirate thyroid fluid, the cells from there, to see if it is cancerous or not. So those of you with Hashimoto's thyroiditis, you do know you have a 30% higher rate of thyroid cancer than other people. So I'm extremely cautious about what we put around the thyroid, what we put on the thyroid, and I order a thyroid ultrasound on most people as a baseline in the office. If you've never had a thyroid ultrasound, you probably want to talk to your provider and get a thyroid ultrasound ordered, okay? Women are 3 times more likely to have thyroid nodules. About 30% of women in their 30s will have at least one, and most women will develop a thyroid nodule by the time they're 50. I didn't know that. I just learned that today when I was on the airplane. So women are 3 times more likely. We are 3 times, 8 times, 10 times more likely to have everything than a man is. I'm just telling you, this is proof on how strong we are, because men die, 6 years earlier than us, but yet we have all these things going on with us. So we are tough, ladies. I'm telling you right now. All right. So what are we going to do about testing? So you have thyroid nodules, and we talked about that. What are we going to do about testing? Again, if your provider is only checking a TSH, they could be missing up to 80% of all hypothyroid patients. Hashimoto's can be present for decades before. When the TSH is anywhere, which stands for thyroid stimulating hormone, is anywhere between 2.5 and 10 micrograms per international unit per milliliter, and the T3 and the T4 is within normal limits, this is known as subclinical hypothyroidism. And I think that's absolutely ridiculous, because anything above 2.5, in my opinion, is a hypothyroid for most people. Subclinical. What that means is your thyroid is still working, still able to make enough thyroid hormones, but not without struggling a little bit. Okay, it's just kind of pumping away, but it's having a hard time. You may be having symptoms of fatigue and weight gain and constipation and dry skin and hair falling out and just cold intolerance, cold all the time, hands cold, feet cold, sleeping in socks, things like that. You could be, have subclinical hypothyroid, or actually full-blown hypothyroid. What are the labs that need to be checked? And you guys need to write this down. If you're not one of my patients, if you're one of my patients, you don't have to worry about this. Your labs get checked. These get checked every single time. Every patient who walks in the door, brand new patient, gets a thyroid antibody check for sure. But you want your TSH checked. Free T3, free T4. Remember, your thyroid makes T4 and T3. They also make T1, T2, T5. There's lots of thyroid hormones that are made, but T3 and T4 are the big ones that we check. Remember, T4 is inactive, and it depends on cofactors to convert over to T3 in your body. So when we check the free forms of this, not the total T4 and the total T3, we're actually checking what is available, what's circulating in your blood, and it's bioavailable to be able to use in our tissues and our hormones. Free T4, free T3, TSH, thyroglobulin antibody, thyroid peroxidase antibody. About 90% of all or more Hashimoto's patients will have a positive thyroid peroxidase antibody, TPO. And then you have thyroglobulin antibody, TGA. TGA is also present in Hashimoto's, but not always with Hashimoto's patients. That's the one we look at when we're looking at thyroid cancer. When that one starts to rise, that's the one they look at for thyroid cancer. And then you're going to check a reverse T3. Okay. So you have T4 to T3. If it converts over to reverse T3, it will convert over to reverse T3 in times of stress, right? When we're going through a lot of stress, many times that reverse T3 will increase, and it's absolutely useless and doesn't do anything in our body. It's just taking it away from the free T3 over to a reverse T3. And I have an endocrinologist recently who told a patient of mine, she asked for a reverse T3, and he said, I don't even know what that is. I don't know what a reverse T3 is. It's useless. There's no reason to check it. And he refused to check it on her. But it's important. TSH, free T3, free T4, thyroid peroxidase antibodies, thyroglobulin antibodies, as well as a reverse T3. That's a thyroid panel, okay? Then, of course, we need to make sure your ferritin levels are optimal. Your iodine levels are optimal. Your D3 levels are optimal. And many times I like to check a selenium. Sometimes I do, sometimes I don't. But that's a good thyroid panel right there, okay? And what are your optimal levels? Optimal levels for thyroid, for TSH. And I want you all to write these down so that you have these when you have your labs checked with your provider. TSH, normal range is like 0.4 to 5.5 or 4.0. Quest has lowered theirs down to 4.0, which is good. Sometimes it's even lower. The American Endocrinology Society. No, is that it? The American Society of Endocrinology? I can't remember exactly. They've lowered it down to like 2.5. But optimal TSH is going to be anywhere between 0.5 to 2.0. Okay, that's optimal. Now, I think my patients feel better really when it's around 1.5. Do you know that the average TSH in the United States, the average TSH for a patient not on thyroid medicine like me, I'm not on thyroid medicine, my thyroid works wonderful, knock on wood, works wonderful, is 1.4. That's the average TSH. Uh-oh, what happened here? Whoops, it said I had to log in again. I hope I'm still on here. If I'm on, hit your heart button. If I'm still here, it says I need to log in again. All right, I think I'm still going. All right, TSH, 0.5 to 0.2. All right, I'm still on. I don't know what's up here. Something keeps popping up on my computer that I'm not logged in. Free T4. Oh, in the elderly, 0.5 to 2.5 is going to be optimal. Tiny bit higher there. Free T4, 15 to 23. Well, really, I'm looking at levels here that aren't exactly. Hang on just a second. For Quest, whoops. I just dropped everything. Hold on. Don't go anywhere. That's not very professional. Free T4 for Quest. Let me look at their levels real quick here. You always want your free T3 and your free T4 up to the upper end of normal. Okay. Of course, that patient doesn't have thyroid checked. All right. Free T4 average, or the range is 0.8 to 1.8. So I like your T4. This patient tomorrow actually is watching tonight. That's funny. Her TSH is 1.2. It's absolutely perfect. I mean, I'm sorry. Her free T4 is 1.2. It's absolutely perfect. You want your T4, free T4 to the upper third of normal. Free T3. Okay. The range is 2.3 to 4.2. Now, this is with Quest. This would not be with LabCorp or with AEL or Path Group. They all have different values. We want our T3 to the upper third there, 3.0, 3.5, even close to 4.0, right? This patient's is 3.0 tomorrow. So pretty good. It could stand to be just a tiny bit higher. Her TSH is 0.55. Boom. Right on the money, exactly where I want it. And it's about darn time, actually, this girl. She has horrible adrenal issues. Her ferritin level is only 25. Now, we want your ferritin level 60 to 100, right? Ferritin's your iron stores. That's how much iron you have in storage. It carries the oxygen in your blood. Needs to be above 60 for patients, or I'm sorry, above 80, actually, Dr. Bill Noah says, with patients who have sleep apnea, okay? So above 60 if you want to lose weight. This patient's is 25. We have a hard time with her ferritin getting it up there. Let's see where her iodine level is. Might as well check here. Iodine is 60. It's pretty good. The range for Quest is 52 to 109. I like it closer to 75, 80, or 100, but we don't want to get iodine too high because iodine can cause your antibodies to go up. It can cause your TSH to rise. So I'm really, really careful with iodine, how much iodine that I use. And then your thyroid antibodies, of course, we want those 0, right? Below 9 for a TPO, below 1 for thyroglobulin antibodies, and reverse T3 as low as we can get it. Okay, so those are the thyroid labs that you would check. What else would you check if you're dealing with Hashimoto's? You know, what else causes or can contribute to Hashimoto's? Heavy metals, lead, arsenic, cadmium, mercury, those levels. H. pylori, which is the stomach infection, all right, of the stomach, causes a lot of heartburn, a lot of acid, indigestion, things like that. H. pylori, check that. Epstein-Barr, right? Epstein-Barr, chronic mono. That can be a contributor to Hashimoto's. We need to check your adrenals, need to check your hormones, right? Cortisol tests for your adrenals, your hormones, looking at your estrogen, progesterone, testosterone. All these things need to be optimal and may need to be checked. And then what's the great big one, people? The big one is food sensitivities. Food sensitivitis. Gluten is the #1 inflammatory agent of the thyroid. #1 for Hashimoto's, right? If you have Hashimoto's thyroiditis, you cannot eat gluten again. Not at all. Dr. Mark Hyman says that 1 bite of gluten sets the inflammation back in your body for 6 months. 1 bite, not 1 bagel, not 1 pizza, 1 bite of gluten. Gluten inflames the thyroid tremendously, as does dairy when you have Hashimoto's. I think dairy's inflammatory anyway. But yes, dairy, Mandy, is extremely terrible. And yes, Tiffany, menopause just completely turns your body upside down, just like childbirth does. Childbirth also will bring on Hashimoto's thyroiditis, an inflammatory reaction there of the thyroid. It can be a postpartum thyroiditis. So that's something that we're not even going to talk about tonight, but it definitely is a part of Hashimoto's is pregnancy. So heavy metals, H. pylori, Epstein-Barr. We have a whole Epstein-Barr and a heavy metal Sunday night service you guys can watch. We've got a hormone Sunday night service. We have an adrenal Sunday night service, and we have a whole food sensitivity Sunday night service. I am a big proponent of food sensitivity testing and knowing what it is that you're eating that's hurting you. And I don't have mine here, but I just got my results back, and Jackson just got his back. And my gut is pretty darn clean. Jackson's having some problems. He's got some serious issues with gluten and dairy and beef and chicken and pork, and it's just a nightmare for us. But those create inflammation. So Hashimoto's thyroiditis, itis means inflammation, arthritis, gastritis, colitis, sinusitis, vasculitis, itis. There's a million other itises. Itis means inflammation. What's inflaming you? 9 times out of 10, it's what goes down the pie hole. 9 times out of 10, it's your diet. Then it could be what you're putting on your body, right? Remember, what you put on your body, you put in your body. It could be stress. It could be bad, not enough nutrients, right? Your ferritin levels are off. Your iodine levels are off. You've had radiation to the thyroid. You've had too many x-rays. You've had radioactive iodine, actually. All of those things can contribute to thyroid disease. What supplements do we need to keep your thyroid in check, to keep it healthy, right? Selenium. Selenium has more research on it than any other nutrient out there for thyroid health. I use straight up basic selenium from pure encapsulations, and it works beautifully. The studies show 200 to 400 micrograms a day. One of these capsules is 200 micrograms. I usually don't go to 400 unless they've got a acute or a chronic reemergence of Epstein-Barr. I'll do 400 for about 2 weeks, and then I'll bring it back down to 200 because you don't want selenium toxicity. You can get toxic to selenium. I have one patient who was hospitalized for selenium toxicity before she ever came to me, thank goodness. But selenium will lower thyroid antibodies. It will help with your conversion of T4 to T3. And we are very deficient in selenium because, again, the soil doesn't have the nutrients that we need in it anymore. We're turning that soil over so fast. Selenium and iodine and zinc and copper and magnesium and all those things are deficient. So I do believe a good selenium, a good clean selenium, 200 micrograms of selenium, I know works. Iodine, low dose iodine. Now, I am not a proponent of high dose iodine. I know with Dr. Brownstein, he thinks high dose iodine is fabulous, and that may work for his patients, but I don't do that with my patients because it has caused problems with my patients. But I do love low dose. I use 6.25 milligrams. And usually I have patients take it every day for a while, and then they'll go to just like 3 times a week, and it's sufficient. Every cell in your body has an iodine receptor, okay? And iodine is breast cancer protective as well. So there's a correlation between low iodine and elevated estrogen in your body with breast cancer. So, and they say the bigger the breast, the more iodine that you need. So, but I use low dose iodine. Straight up, this one comes from Zebra Formulations. I've used them for years, probably 8 years, but there's lots of good iodine out there on the market. I don't use more than 6.25 milligrams, and really probably 3 milligrams. That's why I usually have people do that 3 or 4 times a week, which averages out to like 3 milligrams a day. Vitamin D3, you've got to have your D3 optimal in order to be able to make T4 and T3. And I just use a basic Metagenics D3 in our office, but vitamin D3 is fat soluble. So it's one of those things. You don't just start it unless you know that your D3 level is low. The majority of the people are low on D3. Dr. Alan Gaby, he doesn't believe in high dose D3. He's a phenomenal doctor, and he does a tremendous amount of nutrient IV. I'm not IV. Well, he does IVs too, but he does a lot of nutrition therapy. Anywhere between 1,000 to 5,000 international units of D3, sometimes 10,000 short term, to get your D3 level up there to 40, 50, 60, 70. I like it between 60 and 80, but they say anything above 40 is absolutely wonderful and perfect. I do like it a little bit higher, right? So you got to have zinc, you got to have selenium optimal. You need your D3 optimal. You need your ferritin optimal, your iron stores, your zinc levels. Zinc is part of that, helping convert T4 to T3 level as well. 30 milligrams of zinc a day. That's really all that I start patients with, and it's part of the Hashimoto's protocol. Sometimes I do them all separately. It just depends. Sometimes I do a product that has everything in it. I love these 2 products right here. I love Thyroid Support Complex. This is one of my favorites. It's got 200 micrograms of selenium. I think it has 30 of zinc. No, it has 20 of zinc. It's got a little bit of iodine. It's got A, C, D in it. It's got tyrosine, ashwagandha, all the things, forscoli, turmeric, googles, all the things that we use. This is one of my all-time favorites to start patients off with or without Hashimoto's. This is a really good one from Pure Encapsulations. And actually a patient of mine who moved here from Hollywood, she turned me on to that about 4 years ago, or maybe more, 4 years ago. Yeah. And then there's T150. For patients who need a bigger boost, they need, their TSH is really high normal. They don't want to start a thyroid medicine, something like Armor or Nature Throid or Synthroid or what have you. They want to try to do it naturally. T150 is the highest powered glandular that I have found on the market personally. It is thyroid gland, adrenal gland, anterior pituitary, thymus, spleen. I mean, it's got all kinds of glandulars in it, from organic, grass-fed, bovine. So these are cows from Argentina, okay? They're healthier than our cows. And I actually learned about that when I was in Scottsdale this weekend. 2 capsules of these equals about 30 milligrams of armor. Yeah, and I found that out from Dr. Cheryl Burnett, who owns Dunwoody Labs. She told me that. 2 capsules, T150. I like it. If anybody's used T150, Sarah, what are you on? Are you on T150 or are you on thyroid support complex? I'm not quite sure. I don't remember. But there's all kinds of different ones out there, right? So you want to make sure your zinc is optimal, your D3, your selenium, your iodine, okay? Your glutathione levels. Glutathione is the master antioxidant. The master antioxidant. It's the one antioxidant that mops up all of the free radicals in your body. I use 2 different glutathiones in my office. I use this Zymogen one that's a lotion, and I rub it right on my thyroid every single day because I'm determined when I go back next year to have my thyroid ultrasound done. My thyroid nodule is down. This is this is glutathione cream. Also use the one from Wellness Formula that I love, that is 250 milligrams twice a day. That's a fabulous glutathione. Glutathione mops up all the free radicals. It gets rid of those rusty pipes. It helps your body. Well, it's an antioxidant, so it helps with inflammation. Okay. I love glutathione. Does anybody there use glutathione on here? Fish oil. So how are we going to decrease inflammation? So if you have Hashimoto's, we have to decrease the inflammation, and then we have to prime the body, the thyroid, back up to work again. We're going to decrease the inflammation with things like fish oil, a high quality fish oil. It doesn't have to be Metagenics. Nordic Naturals makes a great fish oil. Carlson Labs makes a great fish oil. I just happen to use this one, and I think it's the best, but you know, there's other ones out there. You've got to cool it down with things like fish oil, glutathione, N-acetylcysteine. Cool the thyroid down, prime it back up to work with zinc, selenium, ashwagandha. Who uses ashwagandha here? Ashwagandha helps convert T4 to T3 in your body, which is fabulous. We've discovered that. It also is an adrenal adaptogen. I use it for my patients with adrenal fatigue, right? They can't sleep at night, or they're wired but tired, or they're adrenally fatigued. They have too much going on, or they have too little. Ashwagandha is an adaptogen that will bring up your cortisol or bring your cortisol back down. I adore ashwagandha. If you have a hard time sleeping at night, this is one of my all-time favorite things right here. But it helps convert T4 to T3. So I recently, like the last 3 years, added it to my supplement protocol with patients for Hashimoto's. Turmeric. Dr. Isabella Wentz is a big proponent of turmeric. She wrote The Root Cause, which we're going to talk about. But turmeric is huge for inflammation in the thyroid and overall body, right? So I love this one. I use Gaia's turmeric. I think it's phenomenal. Gaia's turmeric, curcuma, NFKB. This one is from Metagenics. And what I love about this, it has frankincense in it. It has ginger, xanthol humol, curcumin, and then it's got some other phytosterol, polyphenols in it. It is phenomenal for inflammation. You talk about joint pain, you talk about bringing down inflammation in the thyroid, helping with homocysteine levels as well. I mean, C-reactive protein. This is a phenomenal product right here. I'm thrilled with them. This is only about a year, maybe 2 years old. I'm not sure, but I use a ton of that to help cool the thyroid down and prime it back up, as well as Dr. Isabella Wentz uses Wobenzyme enzymes. I don't know if you all use them. I don't have those in the office, but if anybody uses those, you're welcome to say it up here and talk about it. Hey, Bonnie. Enzymes, which help to convert T4 to T3. It also help to bring inflammation down, bring the antibodies down in your body. And of course, a really good liver support, right? A liver support, because your liver metabolizes most everything in your body, good or bad. If your liver's gunked up, your inflammation's going to be worse. Your estrogen, your hormone levels are not going to be optimal. Your thyroid levels are not going to be optimal. Your inflammation's going to be worse. You're just going to slow everything down if the liver's not functioning properly. So I use a really great liver support from Zymogen called MedCaps DPO. It's got turmeric in it. It's got milk thistle in it. It's got green tea in it. Oh my gosh. It's got a million dandelion root in it. Oh, I don't know, a million things. I forgot it at the office this afternoon, but very, very important for antibodies in bringing down inflammation. So as we've talked, we've got hypothyroidism, Hashimoto's, thyroiditis, you know, the labs to check, you know, the supplements to take, 200 micrograms of selenium, 30 milligrams of zinc, about 300 to 500 milligrams of ashwagandha. Turmeric is usually exactly what says on the bottle. Iodine, no more than 6.25 milligrams a day. Glutathione, 250 milligrams twice a day, or the glutathione cream on there. Fish oil, at least 2,000 milligrams a day of fish oil to help bring down inflammation. And then, you know, I'm a big fan of a good phyto multi, as is Dr. Isabella Wentz as well. A good phyto multi to give you all the phytonutrients in your body and just support you that way. This is my personal vitamin, the one I use, the phyto multi. There's great multivitamins out there. You just want to make sure that you're not overdosing too much selenium and zinc and things like that if you're taking a good multivitamin. Now, as I can't remember who said, Mandy, about the frankincense. I use Young Living frankincense on my thyroid every day. I put it right here. And I always tell my patients, if it's good enough for Jesus, it's good enough for me. I put it right here. Also use lemongrass on it, which I forgot at the office. I picked up frankincense and left the lemongrass there. And then you can use myrrh as well. So frankincense, myrrh, lemongrass, all of those things, not going to hurt you. I don't put mine in a carrier oil. I just put it straight on. And I also put this frankincense, the Young Living one, doTERRA makes a good one as well. I put it right on my face at night. I put it right here and just kind of put it all in, rub it all in. All right. It's good for inflammation. Okay, now we're getting into all the nitty gritty on the actual prescriptions, right? So I want you to know that no treatment option is, are you all still seeing me? Okay, yes, you are. My computer, for some reason, says we're stuck on 27 minutes, so I have no idea where we are. It says we're stuck at 27:04, and I don't know. I'm scared to hit the reload button, but I think you guys are still seeing me. Okay. Well, I'm going to keep doing this then. I have no idea what's going on. All right. There's no one treatment option that is the best. Okay. Not one at all. So there's no, here's your pill, here's your pamphlet. Know that if your provider just says, here's your levothyroxine and you're on your way, then you need to find a new provider. Okay. And this is a big deal. There's a million different thyroid prescriptions and pharmaceuticals out there. We have Synthroid, right? Synthroid is synthetic levothyroxine, T4, okay? T4, levothyroxine is T4. It's synthetic, all right? There's nothing wrong with Synthroid. Synthroid is the #1 written prescription actually in the United States, by the way, #1. Or it may be right behind one of the statin drugs, but it may be #2. But it's at the top. It is an excellent pharmaceutical. There is no gluten in Synthroid. That is a myth. It is made in a factory, though, that has some gluten, that there's some gluten things in it. So they can't guarantee 100% that it's gluten-free. But there's one manufacturer who makes Synthroid, and that is AbbVie, AbbVie, okay? One manufacturer makes Synthroid. Multiple manufacturers make levothyroxine, generic. Synthroid is the trade, right? It's branded Synthroid. One manufacturer. Multiple manufacturers make levothyroxine. I do not write levothyroxine for my patients, okay? I do not. I have maybe 3 patients out of a couple thousand patients in my office that are on levothyroxine, and they came to my office on levo and they were doing fine. The reason I do not write levothyroxine, so go look at your bottles, go see what your prescription says. If it says generic for Synthroid, then you're getting generic thyroid medicine, levothyroxine. The reason I don't write levothyroxine is all generics, all generic manufacturing, generic drugs by law, as governed by the FDA, the Food and Drug Administration, can be 20% underactive to 25% overactive. All right. So that's no big deal in a lot of medications. A lot of antibiotics, it's fine if you get 80% effective or 125% effective. It's fine. Most generics, or Nexium or migraine headaches, right? Well, medicine. Okay. There are 3 pharmaceuticals that I would never personally write generic. One is thyroid medicine. One is seizure medicine. One is blood thinner medicine. Those are drugs that are called narrow therapeutic index drugs, NTI drugs, meaning small changes in the blood, tiny changes in the blood can create problems. You can have too much of that medicine in your bloodstream or too little, okay? Thyroid medicine is dosed in micrograms. So think about that. An aspirin is 325 milligrams. Your thyroid medicine, Synthroid, 100 micrograms. So if you're getting a generic thyroid medicine, you're on 100 micrograms. You could be actually getting an 80 microgram if you're using generic, an 80 microgram or 125 microgram. So that being said, you could go hypo if you get it 80 micrograms and your body needs 100, or you could be hyper if you're getting 125 micrograms. That's why many times it's very difficult to manage and to level out a thyroid if you're getting generic thyroid medicine. If you have to constantly go back to your doctor and your TSH is elevated one time and low the next, and they're like constantly doing this, double check with them and make sure, tell them, say, I want branded Synthroid if you're on Synthroid. Okay. It's the same for pig thyroid as well. You want the brand that you're on. And your doctor's going to say, or your provider's going to say, there's no difference. You say, yes, there is. There's a huge difference. Thyroid medicine is a narrow therapeutic index drug, and I know it needs to be branded. They're going to love you for that. All right. So do not take generic. Now, if you're doing fine on generic, then keep it. But here's my pearl. This is the pearl that you'll get out of this if you're on generic. Always get 3 months at a time then on generic, and have your provider write on that prescription, same manufacturer every single time. Same manufacturer, right? So then you're getting it all from Myelin, or you're getting it all from, I don't know who all makes it, but anyway, Acela, okay? So 3 months at a time. You have Synthroid, you have Levoxyl, right? You have generic levothyroxine. You also have Tyrosint. Tyrosint is very expensive. It is a liquid T4, and it works beautifully. It's in a gel cap. The only ingredients in Tyrosint are gelatin, glycerin, water, and levothyroxine. That is it. There's nothing to break down. There's nothing to do. It just dissolves in the gut, and it's wonderful. It works beautifully, but it's expensive, and many times insurance doesn't cover it. When I can't get patients regulated and really doing well on their thyroid medicine, I will switch them over to Tyrosint, and I'll tell them, now look, it's going to cost you some money, but most of the time it works absolutely beautiful. That's Tyrosint, Tyrosint. You can look it up online, okay? So you have levothyroxine, generic, multiple manufacturers. You're going to always get 3 months at a time and have your provider write on there, same manufacturer each time, if in fact you have to be on generic. I would go to straight Synthroid. It's going to cost you about $30-something a month. You can go straight through a company called Synthroid Direct, and your provider can send it down to this pharmacy in Florida, in Lakeland, Florida. You get 90 days at a time for about $60. So, and it is Synthroid. So you can do that, Synthroid Direct. Then you have T3, Cytomel. T3, remember T3 Liothyronine is the gas pedal of your body. It's what gives you your energy. Your Synthroid, your Levoxyl, your Tyrosine are absolutely useless in your body unless you're converting that T4 over to T3, which is what gives you your get up and go. All right. Cytomel. I write a lot of Cytomel. I put a lot of patients on Cytomel. The side effects of Cytomel or liothyronine would be heart palpitations, too much weight loss, diarrhea, anxiety. Pulse is elevated at night mainly. That's when most people notice it because it's your metabolism. So, excuse me. I'm a big fan of adding Cytomel and Synthroid, or sometimes even Cytomel with Armor or Nature Throid or WP Thyroid. But you have to be so careful because it controls your heart rate and it controls your metabolism. So you have to start very slow. Many times I'll have it compounded in a sustained release. T3 Cytomel is immediate release. It's released and it's in your system, boom. And then you have to dose it twice a day. So most people do it in the morning with their thyroid medicine and then they dose it again in the early afternoon. That's Cytomel. You can always ask your provider about it. Whether or not they'll write it, I don't know. Dr. Dauphin believes in it, the endocrinologist, and so he doesn't take my patients off of it 99.9% of the time when I have them on it. Then you get into desiccated pig thyroid, your porcine, your desiccated pig thyroid. And this is what I write the most of. I write a lot of Synthroid. In fact, I'm a heavy writer for Synthroid because I have a lot of patients who don't do well on pig thyroid. But I write more desiccated pig thyroid. You have Armor, who's been around for a long time. There's no gluten in Armor. They do use the dextrose, and Armor comes from cornstarch. So if people don't want corn, then they may not want Armor. You have Nature Throid. You have NP thyroid from Acela. You have Westhroid, WP thyroid, which is hands down the best thyroid medicine I have ever found to work. Well, guess what? That's the one that's on back order that we're getting ready to talk about. Those are desiccated pig thyroids. They're made from pig thyroids, not cow thyroids, not sheep thyroids, not anybody's thyroid but a pig. And I've got some cool stats to share on pigs with you all, pig thyroid, about this. So those are your pig thyroids. You can chew them. You can chew your thyroid medicine, your pig thyroid medicine, and sometimes that helps with absorption. I have patients put it right here in the front of their teeth and chew it because you'll lose it a lot of times in the back. It'll get stuck in your teeth. Just chew it right here. Drink the water down. Many times that helps with absorption, okay? So you've got Synthroid, that's branded thyroid. Then you have levothyroxine, which is generic. There's nothing wrong with generics. Generics are fantastic drugs. Thank God for generics for many reasons. Most of the time, no, I shouldn't say most of the time, many of the times, people who come to functional medicine clinics like us, they don't do well on generic thyroid medicine. There's nothing wrong with it. If you're on it and you're doing fine, then stay on it. But my trick would be get it for 90 days at a time and make sure you're getting the same thyroid medicine every time. If in fact your TSH is fluctuating like this, you may be a stable Nelly over there, and that's fantastic, but most people are not. Then you have desiccated pig thyroid, right? And you've got your T3, your Cytomel. Then there's compounded thyroid medicine that comes from a compounding pharmacy. Well, I compound a lot of T3, T4. I compound a lot of T3 sustained release so that patients, it can be released over the course of a day, right? They don't have to take their thyroid medicine or their T3 twice a day. So there's many different options. This is what I'm saying. There's way more than just levothyroxine out there. And if you're not doing well on your thyroid medicine, then you need to find something different, and you need to find a provider who'll help you find the right medication for you. How do you take your thyroid medicine? This is huge. You need to write this down. You need to drill it in your brain. If you take thyroid medicine, you take it always on an empty stomach. Always. No questions asked. Your thyroid has to be on an empty stomach at least 45 minutes to an hour before you put anything else in it. That's coffee. Now you can drink water, but that's coffee or anything. 45 minutes to an hour. You're going to want to write this down. All thyroid medicine has to be 4 hours away from iron, calcium, soy, dairy of any kind, walnuts, grapefruits, Tums, anything that's got loaded with calcium, right? Cottonseed meal. Yeah, those are your ones right there. Iron, soy, calcium, dairy, cottonseed meal, Tums, walnuts, grapefruit. 4 hours away from those foods and products. 4 hours. If that means you have to take your thyroid medicine in the middle of the night, you set your phone right here for 2 in the morning, 3 in the morning. You get up, you take your thyroid medicine, you go back to bed, and then you can do whatever it is you want to do when you get up in the morning. But it has got to be 4 hours away from that. If you're having a hard time with your TSH fluctuating up and down, take your thyroid medicine in the middle of the night. I know your stomach is empty. And trust me, it's worth it. The patients I have that have trouble, and I have them turn around and take their thyroid medicine, then they do much better. Okay. All right. That's thyroid. That's how you take it. Now, again, you've got to eat an anti-inflammatory diet, right? No gluten, no dairy, soy, corn, sugar, eggs, peanuts. These are all pieces of the puzzle here. An anti-inflammatory diet. You have to eat real food. Many times an autoimmune paleo diet works beautiful with Hashimoto's. It's difficult. Also cutting out high doses of your goitrogens, right? Your broccoli, your cauliflower, your cabbage, your kale, Brussels sprouts, collard greens, spinach, and there's lots more cruciferous vegetables out there, all right? And goitrogens. Okay, we need to get moving here. You need to sleep 8 hours every night, right? You need to no artificial sweeteners. You want to increase your water intake to half your body weight in ounces every day of good, clean water. You want to eat an anti-inflammatory diet. And remember this on your thyroid, that you weren't born with thyroid nodules, right? You weren't born with Hashimoto's. You weren't born hypothyroid. Now, some people are, but hopefully you weren't. If you were, then you were. But if you're not, if you weren't born with any of this. You weren't born with thyroid cancer or inflammation in the thyroid. We turn that on through decades of dysfunction, all right? What you turn on, we can begin to dial down and turn off. This is the Bible for Hashimoto's thyroiditis right here. This is the root cause. Isabella Wentz wrote this book. It is fantastic. She also wrote this one, The Hashimoto's Protocol. And both of these books have been lifesavers to my patients and to me. Highly, highly recommend Isabella's books. I met her in August and had lunch with her, and she is absolutely precious, and she's amazing. She has totally brought Hashimoto's to the forefront in the United States and across the world. Something else I was going to say to you. We can fix this, right? If we need a thyroid ultrasound, then we get a thyroid ultrasound. If you need a fine needle aspiration, then by gosh, we do a fine needle aspiration, right? You do whatever it takes. We find an endocrinologist who's going to work with us and who's going to listen to you and who's going to, help you bring your thyroid antibodies down and help save your thyroid. Just because you have thyroid nodules does not mean you need to have your thyroid removed. I have patients who remove their whole thyroid. I have patients who remove half their thyroid, but you have to do what's best for you. There's no right or wrong here. If you take synthetic thyroid medicine and you do great on it, don't let anybody tell you that pig thyroid is better for you, because what works for you is what works for you. What works for me works for me. So you have to find a provider who's going to help you figure that stuff out. But take great care of your thyroid, people. Don't put anything near your thyroid. I'm going to be having a Mary Chubenko is going to be doing a lunch and learn for us on November the 2nd, and it's on cleaning up your beauty products and your all the toxins in your life. And I'm so excited. It's November the 2nd. It's under events on Dani Williamson Wellness. You need to sign up and come for that. I've been using, she sells Crunchy Makeup, the brand, and it is phenomenal. I used Beauty Counter for years. Crunchy, takes it to a whole nother level that Beauty Counter can't even touch. And I am loving their foundation and their products. So that's going to be a ton of fun. It's going to be way more than just makeup that night. I mean, we're going to be talking about toxins in general. So, all right, everything. The reason you guys are on here tonight, we are going to talk about my trip to Scottsdale. If you're not interested in the trip to Scottsdale, then sign off here. And I love you guys, and I'll see you next week. But if you take WP Thyroid, Nature Throid, or West Throid, you're going to want to hear this. I was so blessed to be one of about 40 providers that were invited across the country to come out to, and pharmacists, there were pharmacists there, to come out to Scottsdale this weekend to RLC Labs, the manufacturers of those thyroid medicines. As many of you know, WP Thyroid, Nature Throid went on back order last year. WP Thyroid, which only uses chicory root, coconut oil as their two inactive ingredients, right? So the coconut oil or medium chain triglycerides from coconut oil. It's the cleanest thyroid medicine on the market, and it works better than any. And it has caused a nationwide debacle that they have been out of stock for a year, almost a year. It's been almost a year. So here's what's happened. RLC Labs is a privately owned company. I didn't know that. It's a mom and a pop. Rick and Judy own this company. I met the owner. If many of you may have seen the picture of Rick and I. It's an unbelievable company. 75 years they've been doing thyroid medicine and many more things, but they are privately owned. In March of 2016, they received a letter, right, in the mail, and I guess other manufacturers did too, that there would be a 10,000% increase in the cost of raw materials. 10,000% increase. 10,000. Do you know that? Nothing goes up 10,000. I raised my fees last year $25 and people went crazy on me. $25, first time I'd ever raised them in almost 4 years. 10,000% in raw materials. We're talking thyroids, raw thyroids here. So they made a decision. They raised the price one time of Nature Throid and WP, and then they decided not to raise it anymore because there was no way that it was going to be priced out. So they put their own money in this. They have kept it going with their own money with these materials until they made the decision that they were going to start manufacturing their own active ingredients per the United States Pharmacopoeia, which is USP standards. Okay. So they went from having to use other people's active ingredients to going to be making their own active ingredients. Well, you can imagine what this entails. Number one, they had to move into a whole new plant this year, and that's where I was, out in Scottsdale. They're still waiting on equipment 20 weeks later to be delivered to them, to package, stamp, make. It's fascinating, this lab or this manufacturing process. So that being said, do you know that it takes there are 2 to 3 million pigs a day slaughtered? We use their thyroids, right? 2 to 3 million. It takes 2 to 3 million pigs a day to be slaughtered to keep these raw materials up, right? The thyroids are frozen then in a huge block, and they're shipped to RLC Labs or other manufacturers who make thyroid, right? They're in these great big blocks, right? 98% of all thyroids are from pigs in the United States, from the Midwest, right? And it's like Oklahoma, Iowa, all the way to East Tennessee, in that area, some in Texas, 98% of the US. They've just added in Alberta, Canada, because of the demand. They can't keep up. And Alberta, Canada is now growing pigs for them. It takes 6 to 8 months to grow a pig big enough to slaughter it, to use its thyroid. These are all things I find fascinating. If y'all find these fascinating, hit your button, because I think this is crazy. Now, they're not just killing 2 to 3 million pigs a day just for their thyroid. Those pigs are being made into bacon and pork chops and, ham and pork loins and pork tenderloins and all the things they do, hot dogs and all that they do with pigs. But 2 to 3 million pigs a day it takes. These these are not all organic pigs, and that was a big question. So none of your thyroid medicine is organic, and here's the reason. Well, number one, there are only enough organic pigs grown in the United States to equal approximately only 1 kilo of freeze-dried thyroid a day. RLC Labs by itself uses 15 to 20 kilos daily for manufacturing of thyroids, of pig thyroids. There's not enough organic pigs out there. So these are not organic pigs. What you're taking is not organic. It's just what it is. They try to get it as clean as possible. They are working on growing their own pigs and doing that. But you can imagine what a big deal this is, all because there was a 10,000% increase in the raw materials from one manufacturer. It's a shame. So they moved to the new facility this year to accommodate all these changes. I mean, they've had to change everything. They've been doing the same thing for 75 years. They're changing everything, right? They're now in the process of waiting on more equipment. We talked about that. Nature Throid has already been released, right? But it is slow. It is slow and tedious because they're missing some of the equipment. They're having to hand do some things, hand label things and all of that. They can end up doing something. I can't remember how many bottles. They said it was ridiculous, 3,000 bottles a minute or something crazy when they get it up and going. Nature Throid will be first. They will get all dosing out there, 16.25, 32, 48.75. All of that will be finished first before WP production starts up again. But WP Thyroid will be back on the market. I looked him square in the eye and I said, you're not calling us all out here to tell us there's no WP, are you? And he said, absolutely not. It will be back on the market, but they're having to wait for the raw materials. And I asked why they did Nature Throid before WP when WP is clearly superior to any thyroid medicine on the market. And it's interesting, and most people all agreed with me there, but Nature Throid way outsells WP Thyroid. So there are way more people on Nature Throid than there is WP Thyroid. So it was a financial decision. I mean, they have to keep the doors open. They had a 10,000% increase in raw materials, so they chose Nature Throid first. Wasn't my decision, but WP Thyroid will be back in business. It is coming back. I was so impressed with the culture of that company. If you go to rlclabs.com, read about them. They are a phenomenal company. And I'm telling you, culture in a company starts from the top dog, and that would be Rick. And I was blown away by the family, by the employees, by the entire production out there. And I was thrilled to death. I mean, I was out there with Dr. Edwin Lee, who's like the top endocrinologist we have, functional medicine. In fact, he sat with me on the bus. I mean, it was just unbelievable who I was hobnobbing with. And I'm thrilled that they brought us out there. They brought us out there to say, hey, look, we know this is a problem. Thank you for sticking with us. We're coming back. We'll be back bigger and stronger than ever, but it takes time. It takes time. They're growing their pigs. They're looking into all different kinds of things. But I mean, this is not some easy process. I mean, it's big. I was really in awe of how, you think about it. So actually, I will share with you all whenever I get it from the head guy there at the plant. I said, well, Dr. Lee asked, how many pigs does it take to make one bottle, 30 tablets of 65 milligram WP Thyroid? And they actually have it on a spreadsheet, but he couldn't remember it. So whenever I find that out, I'll let you know. It's a lot of pigs going into one of your thyroid pills, by the way. So, all right. For those of you who have struggled with, and I've had this happen recently, TSH levels have gone up, okay, on Nature Throid. I wasn't the only one. I didn't ask the question, but somebody else did. They're having problems. I've had some TSH levels up in the 60s, 70s, 80s. I had 100 and something recently. They've heard this, but they have not changed anything. We asked, did you change the formula? Has anything changed? Has any of the inactive ingredients changed? Nothing has changed. So they don't know. But here's what they recommended. If you're not my patient, you find out the lot number on the bottle that you're taking, and you email that to RLC Labs, and they've got a contact area on there. So they're trying to figure out where the problem is. If you've got an elevated TSH, if you don't, then don't worry about it. If you had a smooth transition over to Nature Throid, then that's amazing. But some people have had elevated TSH levels. So that's the story. That's the state of the union on WP thyroid. It is coming back. Not likely it'll be back by the end of the year. Because they're still waiting on equipment, but it is coming back in 2019 for sure. They assured us that it would. Nature Throid is up and running, and hopefully your pharmacy has got plenty of it. I know that Allen Hill Pharmacy has tons of it. Health and Wellness downtown has lots of Nature Throid as well. So those two pharmacies, I know for a fact you can have your prescriptions transferred to them if you're on Nature Throid. And Walgreens, Walmart, CVS are out of it. Allen Hill Pharmacy and Health and Wellness. All right, guys, upcoming. October 19th is the Hashimoto's meeting at Nashville Restorative Dentistry, 6:30 at night. You guys are welcome to come. November 2nd is the crunchy lunch and learn thing, but it's actually at night. We're doing it on a Friday night at 6:30. So leave the kids at home, leave the husband at home, and come learn all about cleaning up the toxin stuff. And then you're welcome to come steam your yoni, get on the biomat, or get upstairs in the sauna. We are loving that. And also, thanks guys for hanging in there. I know we're 15 minutes over, but this Tuesday night, Integrative Family Medicine has been nominated as Business Leadership Award of the Year, a business of the year for Healthcare Leadership Award of the Year. That's it. Tuesday night is the award ceremony through Williamson Business Leader or whatever. Anyway, there's 3 companies, me and all the Results Physiotherapy and another company, and we are the top 3, and they're going to announce the winner Tuesday night. Say a prayer. It's a great big dinner. I bought a table of 8. My office is going to be there. I'm nervous. I don't know how in the world we're going to win, but you never know. We're the little ones. We're the only female-owned business and the only one who doesn't do $22 million a year in business. I mean, good Lord. These are like huge companies. So say a prayer, because that would be something if a functional medicine clinic won the Healthcare Leadership Award. We were nominated by Mark Wolf, and I'm just so grateful to even be in that category. And so anyway, all right, you guys, have a great week. I love you. I'll be back next week. And remember, take care of your thyroid. It's the only one you have. All right, take care of it. All right, guys, we'll see you later. It's not letting me end. It's not letting me do anything. Oh my goodness. What is going on with my